Hi, Allison.
Yeah, hi.
Hi, my name's Rachel. I'm the nurse practitioner here today. So I see you here for an annual physical. Okay. So we're just going to start off by going through a little bit of your medical history, your past medical history, and asking you a bunch of questions. Okay?
Okay.
So I see from your previous file that you have a history of MS. Do you have any other medical history?
I have a pituitary adenoma.
Okay.
I also have postmenopausal bone loss.
Okay. Now with your MS, do you know what type of MS you have?
Yeah, relapsing remitting.
Okay. Any complications with that?
I have some balance issues. I have foot drop in my right foot. If I get overheated, or, temperature's too warm, then I get very weak.
Okay. All right. And then as far as past family medical history, your mother and father, anything significant?
My mother had breast cancer and she
Okay.
passed away from breast cancer when she was 58.
Okay.
My dad had pulmonary fibrosis and passed away from that when he was 89.
Okay. Any other medical history in your immediate family, brothers, sisters, anything like that?
No.
Okay. Have you been screened for breast cancer yet?
Yes.
Okay. Okay. And then as far as medications go, are you on anything for your MS or any of your other medical issues?
Yes. I take vitamin D, prescription vitamin D, 50,000 units twice per month for the MS.
Okay.
And then I take risendrate sodium for my bone loss. I take that once a month.
Okay, once a month. And are you on a women's multivitamin?
Yes.
Okay, good.
Daily.
Good, okay. The next part of our questionnaire here is a social history. So it might not seem relevant, but we do ask these questions, okay? So are you married?
Yes.
Okay, how many years have you been married, Allison?
23.
Okay, and do you have any children?
Yes, I have 3. 2 from my previous marriage, 1 from my current marriage.
Okay, any complications with your pregnancies or births?
No.
Okay. Do you drink alcohol, smoke tobacco, use
No.
any recreational drugs?
No.
Okay. As far as your living situation, do you live in a house, a condo, apartment?
We live in a house. It's 1 floor, no basement, no stairs. It's all 1 floor.
Okay, great. And then as far as a working history, are you retired? Do you have a job? Are you on disability, anything like that?
I'm retired from teaching, and I do have a part-time job as a merchandiser for American Greetings. I do go around to stores and do cards, set up card displays and so on.
Okay. All right. So the next part of our questionnaire is just what we call a review of systems. So I'm going to ask you a bunch of questions head to toe about any complications you might be having, okay?
Okay.
So our first section is head, eyes, ears, nose, and throat. So do you have any vision or hearing loss?
I wear glasses and contacts
Okay.
for years and no hearing loss.
Okay. Any trouble swallowing, sore throat?
No.
Okay. And then I see that for your MS, do you follow up with Dr. Drake?
Yes.
Okay.
Yeah, once a year.
Okay. Besides the complications we've already talked about with your MS, are you having anything like frequent headaches?
No.
Dizziness? Anything like that?
Mm-mm.
Okay. Have you ever been told by a doctor that you have high blood pressure?
No.
High cholesterol?
No.
Do you ever feel like you are having a rapid heart rate? Anything like that? Okay. Any trouble breathing or shortness of breath?
No.
Any trouble eliminating your bowels? Any constipation or diarrhea?
No.
Okay. Do you have any skin issues like open sores or wounds?
No.
Do you bruise easily?
No.
Any trouble with urinary elimination? Do you have trouble going to the bathroom? Do you have episodes of incontinence?
Very occasional incontinence.
And then musculoskeletal. I know that we discussed your foot drop and then the balance issues that have come along with your MS. Do you have any other trouble, walking, standing, moving around?
Walking, sometimes because of the balance issues, like if I'm holding onto a cart or something like that, I'm fine. But walking for any distance, yeah. As far as balance, Other than that, no. Standing for a long time. For my job, I have to be on my feet, and 3 hours is about the max I can make it.
Okay. Any history of fractures, sprains, or strains?
I fractured my right wrist 4 years ago. That's the only one.
Okay. And any history of falling?
Yeah, a few times because I fractured the wrist and that was a fall. I've fallen a few other times, but no, not broken anything or sprained anything or anything like that.
Okay. Okay, Allison, do you have any questions for me?
No, not right now.
Okay, I'm just gonna step out of the room. I'm gonna have you put a gown on. I'll give you a few minutes and then we'll be back and we'll finish up with your physical, okay?
Okay, thank you.
You're welcome.